Hello, I'm Dr. Pamela Lockney with Cincinnati Children's Sports Medicine and Orthopedics. This is the second module in this educational series developed for youth coaches. In this module, we'll review heat illnesses, objectives. At the end of this module, you should be able to 1. Understand the risk factors for heat illnesses. 2. Identify 3 types of heat illnesses. 3. Recognize the signs and symptoms of heat illnesses and be able to begin treatment of each type. 4. Use strategies for preventing heat illness. Our bodies generate a lot of heat on their own, and athletes' bodies are no exception. Normally, heat escapes through the skin and sweating cools us down. But certain weather and other conditions can prevent the body's natural processes from being effective, and body temperature can rise to abnormal levels, resulting in heat illness. Heat illnesses occur along an increasingly serious continuum, ranging from painful to life-threatening. Objective 1. Understand the risk factors for heat illnesses. Certain weather and other conditions increase the likelihood of young athletes experiencing symptoms of heat illnesses. These conditions include 1. Increased air temperatures and high humidity. 2. Dehydration. 3. Lack of acclimatization, meaning the athlete has not yet adjusted to doing the activity in a warmer environment. 4. Poor physical fitness. 5. Obesity. 6. Medical conditions such as diabetes or sickle cell trait. 7. Viral infections, stomach flu, or fever. Objective 2. Identify 3 types of heat illness. There are 3 types of heat illnesses which can progress along an increasingly serious continuum. 1. Heat cramps are painful, involuntary muscle contractions, usually in the muscles of the arms and legs and torso. Heat cramps may occur alone, or they may be one of several symptoms of heat exhaustion. 2. Heat exhaustion is elevated body temperature and other signs and symptoms which, if left untreated, can progress to heat stroke. 3. Heat stroke is the most serious type of heat illness and can lead to death if not treated. Objective 3. Recognize the signs and symptoms of heat illnesses and be able to begin treatment of each type. Heat cramps are painful, involuntary muscle contractions. Treat heat cramps through rest, replacing lost fluids and electrolytes with sports drinks and salted foods, and passively stretching the affected muscle. Heat exhaustion happens when the body temperature is elevated up to 104 degrees. 1. Signs of heat exhaustion include fatigue, dizziness, headache, nausea, vomiting, and a rapid heart rate. 2. If an athlete shows any of these signs of heat exhaustion, stop all activity and move him or her to a cooler, shaded area. 3. Have the athlete lie down with his or her legs elevated. 4. Rehydrate with oral fluids and electrolytes. 5. Prepare to transfer the athlete to an emergency room if their symptoms do not improve or if they worsen. Heat stroke occurs when the body temperature is dangerously elevated, higher than 104 degrees. 1. Heat stroke results in altered mental status, meaning the athlete may be confused, agitated, or combative. Stupor and seizures may also happen. 2. If an athlete shows any of these signs of heat stroke, it is critical to stop all activity and move them to a cooler, shaded area. 3. Immediately begin rapid cooling using ice packs to the armpits, groin, and neck, or place into a cold water bath. 4. Call 911 for transfer to an emergency room for additional cooling by IV fluids and other supportive treatments. Objective 4. Learn methods to prevent heat illness. 1. Acclimatization. Over a course of time and repetition in a warmer environment, a young athlete can acclimatize or adjust to exercising in the heat. Have athletes perform the exercise in the warm environment in which they will compete. The acclimatization process usually takes at least 10 to 14 days. The benefits of acclimatization are an increase in the ability to sweat, which helps with cooling the body, a decreased loss of electrolytes in the sweat, and reduced dehydration. 2. Hydration. Athletes should hydrate before exercise and be allowed to take adequate breaks during exercise to drink water or sports drinks based on their thirst. 3. Modify the intensity, duration, or timing of strenuous workouts during periods of severe heat or humidity. 4. Prevent sunburns, which can hinder the body's ability to sweat and cool off. 5. Encourage athletes to wear lightweight, light-colored, and breathable clothing. 6. Restrict exercise activities if the athlete is currently ill. Review of objectives. To review, we've covered the risk factors for heat illness, 3 types of heat illnesses, and how to recognize and begin treatment for each of them, and strategies to prevent heat illness. I'm Dr. Pamela Lockneat from Cincinnati Children's Sports Medicine and Orthopedics, and I thank you for your attention to these important tips and for your involvement in youth sports.